Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
In certain cases, certain type of therapies like chemotherapy or radiation, those patients are suffering from any type of carcinoma or cancer, so that is also on a risk factor, might they get early menopause also. Excessive smoking, nowadays in females also we noticed excessive smoking, so that also affects your hormonal imbalances. It reduced your estrogen level inside the body, it increased stress level, or you can say dopamine and everything get imbalanced. So because of that also, a female may find early menopause in her life also, because smoking is actually a tannin, caffeine, so it's a type of tobacco only. So tobacco is also injurious, or it also disturbs your hormonal secretions. So a female who smokes a lot or a chain smoker get early menopause, or they are on a risk factor, you can say, right? Now what are the symptoms that a female can pass through? Physical and emotional symptoms are always there. So for initially, the most common that every female suffers or experience the symptom, that is irregular vaginal itching, dryness in the vaginal, and bleeding. Irregular bleeding or excessive bleeding. Then vaginal itching, sometimes for 2-3 days you may find itching, then it becomes normal again, after sometimes it starts. So that is irregular. And dryness, sudden dryness surrounding your vaginal area, specifically you feel when at the time of intercourse you may feel pain. So that is the most common symptom. 90% of females who are suffering from the menopause or perimenopausal syndromes, it's the most common. Hot flashes and night sweatings, this is another most common problem. During the menopause, many females are experiencing this hot flashes and night sweating suddenly, like you don't have a insomnia, your sleep pattern is good, your overall lifestyle is very good, but still when you're going to bed by 10 o'clock or 11, so around 2 or 3 in the at the midnight time, suddenly you wake up, and if you notice the whole night was become wet, जिसे बोलते हैं पूरा पानी पानी शरीर हो जाता है. Along with that, certain type of hot flashes, if you sleep under the AC also, AC room, still you feel little hotter compared to the others. You feel very hot. आपको जैसे लगता है कुछ बॉडी में जल रहा है, आग जल रही है. That is called the hot flashes, along with night sweating also. Females are also suffer from some urinary problems, like different physical and visible also. Physical in the sense organs related. During the menopause or just after the completion of the menopause, many females face this problem, the leakage. The elasticity of the bladder gets affected. Because of that, certain times they feel leakages, like if you has a urge to pass the urine while just visiting to the loo, that is just a 10 or 12 steps, many females got the leakages, a droplets of urine passes suddenly. So that is because of the elasticity of that bladder is weakened. That is also because of the menopausal things also. Many a times UTI infection occurs very often. No doubt you look after for the proper hygiene point of view, but still during the menopausal period, many females are prone to face the UTI infection also. Leakage of the urinary bladder, elasticity of the bladder becomes loose. Certain type of burning sensation while passing the urine is also most common problem. So these type of bladder, urinary bladder related problems are occur. Skin problems. So many females specifically feel dryness on the outer layer of the skin. Many suffers from skin disease like itching, rashes, maybe during the menopause, those who had a past history of any chronic skin disease, like you can say psoriasis, eczema, urticaria, whatever the type of chronic skin disease. So during the time of menopausal duration, it gets aggravated, more worsened. लाइक आपको 5 साल पहले जो चीज थी धीरे धीरे ग्रेजुअली क्लियर हो गई, बट सडनली ड्यूरिंग द टाइम ऑफ मोनोपोज you feel it again that scars appears, again that itching is there. So different type of skin problems may aggravated during the menopausal time because hormonal imbalances are there. Estrogen and progesterone level goes down, clearly stop at certain point. So there may be a possibility because female health is related with hormones only. The skin health also relate with hormones only. Physical symptoms also, you can see little bit of physical symptoms like suddenly you feel your weight may be maintained but you feel bloated. Inches wise you can feel like you become fatty though the weight shows the normal things. So bloating, inch wise increasing, fluffiness on your face, you can say more fluffy under your eyes, then your cheek becomes really very जैसे बड़े से गोलगप्पे जैसे चिक्स हो जाते हैं. Then hair growth, uneven hair growth on your face you can notice. Physically you may feel little lethargy, थोड़ा सा weakness बढ़ जाता है. So all this type of changes, even before a year if you noticed your face it is quite tightening of the skin is there, but suddenly within the period of a year you can see the loosening of your skin, maybe some lines are appearing on your forehead, wrinkles are there. So aging process you can note down during this menopause. If you don't look after your health, if you don't give the priority to health, then these are the symptoms that you are facing. Even physically certain type of growth you can notice, rather it is your external or hair or something like that. So all these physical symptoms you can notice. Cardiovascular health, mostly we had noticed after the age of 45 or during the menopausal syndromes, those females who doesn't have any prehistory, no health issues, but suddenly two most problems they are facing. First, hypothyroidism and high cholesterol or triglyceride level. These two things are the most common health issues that occurs during the menopause if you don't care properly. So cardiovascular health is obviously related with your high cholesterol, high BP, that is your blood pressure. Even sometimes eyesight problem is also, सडनली नंबर आ जाते हैं, आइस के नंबर्स जो होते हैं, चश्मे के नंबर जो होते हैं वो बढ़ जाते हैं, आपके आई साइट में थोड़ा सा ब्लर आपको फील होता है, ब्लिंक्स ज़्यादा होने लगती है, काफ़ी लोगों को ड्राइनेस फील होती है आँखों में, अननेसेसरी पानी निकलता है, एक्सेसिव वाटर फ्लो हो जाता है, तो रेटिना पे काफ़ी टाइम इफेक्ट आ जाती है. जिनको डायबिटीज़ है उनको ग्लूकोमा होने के चांसेस बढ़ जाते हैं. So these all are the symptoms along with your cardiovascular health also. Osteoporosis is the most common problem. If you never care about your nutrition, then you may suffer osteoporosis during the menopause. Because as I told you, menstrual cycle also affect on your bone health, because the calcium is required. With the help of proper secretion of estrogen and progesterone, your body easily absorbs the calcium from your food. Now these two hormones stops, then the absorption of calcium and vitamin D is restricted. So you have to pre-plan for all this thing, and that is the reason mostly allopathic doctors will always suggest you certain type of calcium supplements, mineral supplements or multivitamin supplements after the age of 45. That is the reason, because during the menopause your bone health gets affected immediately, and there is a chance if you are lack on minerals, iron and calcium, then you may suffer from osteoporosis also. Emotional and cognitive symptoms are always there. That is the most common. Every female can suffer from these things. Already females are comparatively more sensitive than the males. So when this whole cycle gets switched off, the effect of that whole history obviously shows. So during the menopause, most affected part is emotional part. And that's why whenever we talk about the treatment, we always talk the family support and specifically the spouse, husband support. It really affects to overcome more than the medicine, more than the therapy. Because that personal touch, personal attachment, personal care immediately affects. So these are the most common symptoms that a female can suffer during the menopause or after the perimenopausal phase. Now, how exactly you diagnose? Now, it is very much clear that you notice all these symptoms. You'll come to know, yeah, there may be now I'm 45, 40 plus or whatever, and the symptoms are occurring very often. So let me go and test. Rather, it is a complete menopausal stage or anything else happened. So the best way to consult your gynec first and do certain type of necessary diagnostic test also. So that will help you to exactly clarify rather you are suffering from menopause or any other things are, right? So identify the clinical symptoms first of all. Clinical symptoms means check your overall body, physically how fit you are. Any clinical symptoms means you may suffer from high BP, diabetes, thyroid, all these things are necessary. Physical examinations, definitely you have to go and meet your gynecologist. So physical examination and pelvic examination always done with the help of gynec only, because your gynec will find out exactly while checking the pelvic region, and after that she may suggest you certain type of sonography if she finds something imbalanced, but only with the help of physical checking of your pelvic region and all these things, physical examination like your burst enlarged or not, the tenderness inside the burst is there, the vaginal cavity is there, everything she'll go and check, she or he, the gynecologist. Then they'll very much sure about your menopausal symptoms. Certain type of hormone tests are required to confirm your menopause, which include FSH, LH, estrogen test, progesterone test. All this will help you definitely. Apart from that, as in good health care or prevention, they also suggest you certain type of blood test, which includes your hemoglobin level, so the complete CBC and ESR. Certain lipid profile tests are also necessary to know your cardiovascular health, rather you are suffering from high cholesterol and triglyceride or not. Thyroid test, TSH or FSH is also very necessary, so that any hormonal imbalances will immediately come to know about your TSH and FSH. It affects your thyroxine or thyroid gland or not. So like that, this type of necessary tests are always there to diagnose or precautionary things. If something is there, something is noticeable, so you can work immediately on that, because previously we have the help of hormones. Now these hormones completely stop. Now our body and our food and our lifestyle is the main tool we have to remain. If you don't want to depend lifelong for certain type of medicine, so this natural remedies always help you.